European Society of Endodontology position statement regarding surgical extrusion, intentional replantation, and tooth autotransplantation, which was released in 2021. Teeth that are considered non-restorable by conventional treatments, such as those with failed endodontic treatment, subgingival caries or fractures, are candidate for management by surgical extrusion, intentional replantation, or tooth autotransplantation. These related procedures have a similar approach involving the atraumatic detachment of a tooth from its socket. In surgical extrusion, the tooth is surgically shifted within the socket to a more favorable position so that the remaining tooth structure is more coronally placed. Intentional replantation involves the atraumatic removal of a tooth, inspection of the root surface, extra-alveolar management and repair, and repositioning in the same socket. Tooth autotransplantation involves the extraction of an erupted or unerupted tooth and its placement in an extraction or surgically prepared socket within the same patient. For the pre-treatment considerations, patient consent. The clinician must provide clear and complete information on the risks and benefits of the treatment to the patient. This will allow patient to make an informed decision with regard to the treatment option proposed. For the preoperative imaging, small field of view preoperative CBCT may be helpful in providing 3D information about the anatomy of the tooth and surrounding structures. In tooth autotransplantation, a preoperative CBCT will allow the clinician to create a 3D replica of the donor tooth and a 3D printed guiding template. For the prophylactic antibiotic, systemic antibiotic prophylaxis should only be prescribed for medically compromised patients, such as individuals with complex congenital heart defects, prosthetic cardiac valves, or history of infective endocarditis. Patients receiving intravenous biphosphonate treatment and after joint surgeries in the first 3 months. Also, local debridement of plaque and calculus must be performed before the surgery, and surgical sites must be disinfected to maintain a clean field during the procedure. Chlorhexidine 2% is recommended for the disinfection of the surgical site. For the surgical procedure, surgical extrusion and intentional replantation, during incision, care should be taken to avoid mechanical damage of the root surface and the gingival fibers. Damage to the PDL can be reduced by holding the crown of the tooth with a wet sterile gauze. The root surface should be kept wet using storage media such as Hank's balanced salt solution during all the extraoral procedure. The total extraoral time should be as short as possible and never exceed 50 minutes, as it is a critical factor for the long-term prognosis of the treatment. During extraoral procedure, protection of the blood-filled socket with a sterile gauze is useful to prevent contamination of the site by saliva. If surgical extrusion or intentional replantation is performed to treat teeth with cervical resorption or a deep caries lesion, all granulation and carious tissue within the defect must be removed to avoid recurrence. Socket curettage is only recommended when a periapical granuloma or extruded filling material needed to be removed. The tooth should be reinserted in the socket with a digital pressure and the occlusion should be checked. For the tooth autotransplantation, during extraction of the tooth to be replaced, the clinician must avoid damaging to the cortical plates. The donor tooth should be extracted as atraumatically to minimize injury to the gingival fibers around the neck of the tooth. The recipient site should be larger than the dimension of the donor tooth so that the donor tooth is not inserted into the socket with pressure. Implant drills with internal and external water cooling or piezoelectric insert are recommended for this procedure. The donor tooth requires an orthograde root canal treatment that should be performed before the surgery or after the surgery to minimize the extraoral time Consideration should be given to placement of gauze over the crown before application of the extraction forceps to prevent crazing of the surface of enamel or slipping into the root surface. As soon as possible, the donor tooth should be placed in the recipient side, leaving it free from occlusal and articulating forces. Immature tooth with an open apex, it is usually has sufficient access to blood supply as well as stem cells to promote pulp revascularization post-transplantation, and it does not require orthograde or retrograde endodontic treatment. If signs or symptoms of pulp disease occur, root canal treatment can be initiated. Postoperative considerations. Splinting of the teeth. To support periodontal healing, the splint should be passive, flexible, and allow good oral hygiene. Usually thin wires not greater than 0.3 to 0.4 mm are bonded to the labial surface of the tooth. The duration of splinting depends on the stability of the tooth after replantation and can vary from 2 weeks for most cases of intentional replantation up to 6 weeks for cases of high mobility after surgical extrusion. In specific cases, postoperative fixation can be performed with a crossed suture suspended above the occlusal surface. After this procedure, the occlusion has to be adjusted to relieve occlusal contacts. Standard medication strategies should be applied to reduce postoperative pain, and systemic antibiotics have the ability to reduce infection and can improve the outcome of autotransplantation. Root canal treatment should be performed within 2 weeks after the surgical procedures to prevent inflammatory root resorption. For the restorative and orthodontic treatments, restorative treatment is usually initiated 6 to 8 weeks after surgical intervention, and teeth should not be moved orthodontically for at least 6 months after the procedure. In conclusion, surgical extrusion, intentional replantation, and tooth autotransplantation are important treatments that can be provided within the scope of endodontic practice. The clinician knowledge about these procedures, their management, and possible complications are important to achieve optimal success.